Okay, so today we're going to talk about asthma. What causes asthma? Well, different allergen irritants cause different triggers for people differently. Some examples of what can cause asthma are outdoor allergens, which is pollen from grass, trees, and weeds. Indoor allergens are pet dander, dust, mites, cockroaches, and molds. In air is like smoke, chemical fumes, strong odors, household chemicals. You can also get asthma from exercising. Some non-allergic asthma triggers is weather, cold air, extremely dry air, wet or windy weather, drugs like aspirin and NSAIDs, which is non-steroidal anti-inflammatory drugs, and also beta blockers, and stress. Asthma is a chronic long-term lung disease that specifically affects your bronchial tubes that can be inflamed and narrowed, which causes trouble breathing. There are different types of asthma. So there's intermittent, which comes and goes, so you can feel normal in between the flares. There's persistent symptoms, which happen most of the time, which is considered mild, moderate, or severe symptoms. So people develop asthma at different ages. With adult onset, it tends to happen after the age of 18, and pediatric asthma happens before the age of 5, which can still occur in infants and toddlers, Children can outgrow asthma as well as they grow older. Things that induce asthma are exercise-induced asthma, which is triggered by exercising, and occupational asthma, which is when people work with irritating substance, and asthma COPD overlap syndrome, which is when they both have asthma and a chronic obstructive pulmonary disease. How is asthma diagnosed? It is diagnosed with can be diagnosed with a physical exam, and usually in a physical exam, your eyes, nose, throat, chest, and lungs get checked, and the doctor can listen to your lungs for any wheezing or whistling sounds. But specifically, there are spirometry, which is the most common type of pulmonary function test, which is how much air you can breathe in and out of the lungs, and as well as how easily and fast you can blow the air out of the lungs. Pulmonary function tests is just a non-invasive test that tests the lung volume, capacity, rate of flow, and gas. And the spirometry and pulmonary function test tends to be around 30 to 45 minutes to complete. And then in medical history can also help diagnose asthma. The symptoms of asthma are coughing, wheezing, shortness of breath, chest tightness, sneezing, itchy nose, inflamed eyes, wheezing when exhaling, trouble sleeping caused by the shortness of breath or coughing at night. What to do with an asthma attack? So when a person is breathing normally, the muscles and the airway are relaxed, and so they're like letting air move in and out easily and quietly. But while you're in a asthma attack, there are bronchospasm, which is muscles around the airway are tightened. So when they're like constricted, the airway narrows, which causes air to flow not as freely as it usually is. There's inflammation, so the lining of the airways becomes swollen, and swollen airways don't let much air in and out of lungs. There's also mucus production. During an attack, the body makes more mucus, and the thick mucus clogs the airway. When someone is dealing with an asthma attack, the first thing you need to do is stay calm. Also sit them upright, because if they're in their upright position, that means that they can breathe more with nothing else in the way, so like unobstructed, which would just be like the airway. Eliminate trigger. So you should, if you don't know the person's history, figure out what is triggering them and causing them to have the asthma attack, which they can like get out of the room that they're possibly in. And then follow with the emergency plan. How does a person deal with the asthma? Do they have inhalers, or what do they do? Look for any signs of severe attack. So just make sure that their skin isn't like sucked in between the rib and neck. If there's no discoloration on lips and continue struggling to breathe, because if so, they need to be taken to the doctor, to the ER. Action plans for treatment. So if something is irritating, yeah, it should be like, if something is a trigger, you shouldn't be in the room with the trigger. So for instance, if smoke is a trigger, then don't smoke or allow people to smoke. Leave the area if someone is smoking. Inhaled corticosteroids daily can decrease flare-ups and keep symptoms under control. There's quick relief inhaler, which is used when you're experiencing a flare-up. There's oral medicines. There's bronchodilators, medicines used to relax muscle around the airways. There's anti-inflammatory medicines, which reduce swelling and mucus production in the airways. And there's also biologic therapies for asthma, which is used for severe asthma. The rates and risks of asthma. So asthma rates are highest in Black adults in the US. Asthma is more common in female adults than in male adults. There's quite about around 9.8% of female adults that have asthma, and for men there's only 6.1%. On average, 11 people in the US die from an asthma attack every day. In 2020, 4,145 people died from asthma. In 2008 through 2013, about $81.9 billion was lost in medical costs and days lost from work and school days. Well, asthma tends to come from genetics and the environment, which likely plays a role in whether or not you have asthma or not. Some risks for asthma: being exposed to secondhand smoke, which is inhaling the particles of the smoking after somebody has like smoked it out and smelling it, which can happen when a mother is pregnant, or like as a small child, being exposed to the particles. Being exposed to certain substances at work, which are chemical irritants or industrial dusts. Genetic and family history. There's a history of a parent with asthma, there are chances that the offspring will have asthma, or the child. Race or ethnicity. Black and African Americans and Puerto Ricans are at higher risk. Having other diseases or conditions, which are like obesity and allergies. Often having viral respiratory infections, and sex. So it's more often boys and children, and more often in women and teen and adults. What systems does asthma affect? Well, asthma is a disease that affects your airways of your lungs, which is part of your respiratory system. So asthma is one of the most common and costly chronic illnesses in